We tend to think about food allergies being fairly common and we hear a lot about them, but in reality, only about 8% of children have true food allergies. And what's interesting is that most children outgrow some of these food allergies, and this is evidenced by the prevalence of allergies in adults at only 1 to 2%. So what makes a food allergy different from an intolerance or an aversion, which we'll talk about in a couple of slides? Well, a food allergy always involves the immune system. So what happens when you consume something that you're allergic to is that this food protein enters the body and triggers an immune response. So antibodies, histamine, other defensive agents are going to be released by those white blood cells in the body. And they're going to basically help to prevent or respond to this allergen. Some people may have life-threatening food allergies, and so they actually could go into anaphylactic shock. So they need to carry an EpiPen, which an EpiPen provides epinephrine, which counteracts some of those anaphylactic shock symptoms. So some people just have a mild reaction, their throat gets scratchy, they just need to not consume that food. And some people, like, their throat gets scratchy, their throat closes up, and this can be very severe. So those people would need to have an EpiPen. And allergies are diagnosed by the presence of antibodies. So you can't just diagnose a food allergy because you have symptoms. You actually need to know that you have this antibody present and that you have symptoms. So it's really a two-component piece. And some people may actually not have any, outright symptoms, but the antibodies are present. So the antibody is the key marker of diagnosing a food allergy. Again, you may or may not have symptoms. Warning labels on foods must clearly identify any potential allergens in foods, or anything that those foods may have come in contact with that could be a potential allergen. So there are 8 common allergens that require labeling. These are peanuts, tree nuts, milk, eggs, wheat, soybeans, fish, and shellfish. And those in bold, so peanuts, milk, and shellfish, those are the most prevalent triggers in children. But all of these must be labeled on foods that may contain these allergens or that may have come in contact with them. All right, so it's really important to distinguish the difference between a food allergy, food intolerances, and food aversion. So remember that the food intolerance or the food allergy, you have that immune response going on, and you have the presence of antibodies. Food intolerances are an adverse reaction to a food or a food additive. So you just have these symptoms that occur when you ingest or consume a food or food additive. And these unpleasant symptoms reliably occur after consumption of certain foods. There is no immune response. And so an example of a food intolerance would be a lactose intolerance. So you're not actually allergic to lactose, although some people may have a milk allergy, but you're just intolerant. So you just have these symptoms coming on, but you don't actually have any antibodies present. A food aversion is just a very strong, very intense dislike for food that could be a result of a biological response or a psychological response to maybe something that happened before. So maybe when you were younger, you consumed way too much chocolate and you got sick, and so now you never want to consume chocolate again. Or, maybe you had, maybe you were eating grapes and one got stuck in your throat and you were choking, and that's kind of scarred you for life, per se. So anything could happen that could cause a food aversion. Again, maybe it was an illness or some other negative experience that was associated with that food. And these should be taken very seriously because it could actually turn out to be a food allergy. So don't brush these off, take it seriously. And if it persists and there are, a lot of symptoms, it might be a good idea to get checked out to see if there are any antibodies present and if that could actually turn into a food allergy. All right, what about the role of the diet in hyperactivity? We often hear, that gluten causes hyperactivity, food additives cause hyperactivity, sugar causes hyperactivity, so what's the deal? So food allergies do not cause attention deficit hyperactive disorder, but certain food additives may worsen hyperactive symptoms. So there's been a lot of talk recently that, gluten could be a cause of this in some individuals that are sensitive, certain coloring agents. So it's definitely important to recognize that some people may have an allergy to this, but not everyone. You can't just blanket approach that everyone consumes this and that's making someone be hyperactive. Sugar also does not cause hyperactivity, but it's of concern because it can displace healthier food choices, or more nutrient-dense food choices. So we, again, want to limit our sugar consumption. Inconsistent care and poverty can cause behavior problems just because of a combination of poor diet and a lack of physical activity. So these kids are not getting enough energy in general. They're having low intakes of other important vitamins and minerals, such as iron, which we talked about previously. Know that this can cause some intellectual problems, other behavioral problems. Magnesium, zinc could be related to, decreased immunity. So again, that could tie in with iron of not, being all present all the time, and then omega-3 fatty acids. Dental caries are also another serious health problem in the United States. So caries are cavities. So cavities are caused by the erosion of tooth enamel by acid that's produced by bacteria that cling to your teeth. So every time that you consume something, there's bacteria that are on your teeth, and they're basically, wearing away at your teeth. They're feeding off of that food. If these progress too much, this can cause gum disease or tooth loss. That's why we have cavity fillings. But it can also increase the risk of heart disease because if you have gums wear away or eat away, some of those things that you consume or other toxins could actually get down into your bloodstream, and they can increase the risk of heart disease. So that's not a good thing. So we really want to have proper oral health and hygiene. So what does food do in this? So whenever you consume carbohydrates, this bacteria produce the acid for 20 to 30 minutes after they're exposed to the carbohydrates. So foods that are high in protein tend to not, produce this acid. So especially kids that consume a lot of juices or cookies or, other refined grains, this is just feeding those bacteria. So think about combining some protein in there, especially if you can't. This is even a great tip for you as an adult, is if you can't brush your teeth, if you consume cheese, that's going to produce less food for these bacteria than if you ate like a cookie. So other prevention methods for cavities or caries, when you're younger, you might have sealant put on your teeth. Fluoridated water also helps to improve tooth health. And then, of course, proper brushing and flossing. You've probably heard that breakfast supports healthy growth and development and that it's the most important meal of the day, and this is true. So breakfast plays a very important role in growth and development. Children who don't eat breakfast or who skip breakfast on a common basis tend to be overweight. They snack more on sweet and fatty foods. They perform poorly in tasks that require concentration, so exams. They have shorter attention spans. They have lower test scores, and they're more tardy or absent from school. So you want to eat breakfast so that you can help manage your weight, that you decrease your poor snack choices, that you do better in school or on your exams or in work, whatever that may be. So breakfast really is important. Children who eat school breakfast or just breakfast in general tend to consume less fat overall, and they also have higher intakes of magnesium, vitamin C, and folate. So kids that consume breakfast as part of the school breakfast program have improved academic, behavioral, emotional, and social performances. So again, more evidence that breakfast is very important, especially for children. So the National School Lunch and Breakfast programs, there's often a lot of negative attitudes towards these, but they're actually really a good thing for helping kids meet their nutrient needs. So both of these programs are designed to provide age-appropriate servings of the needed foods each day, and they're based upon the dietary guidelines for Americans. So lunches are designed to meet a third of the recommended intakes for energy, total and saturated fat, protein, calcium, iron, and vitamins A and C for the different age groups. Recent changes in the programs have increased, availability of fruits and vegetables, increased whole grains, low fat and fat-free milk, and this has also reduced sodium, saturated, and trans fat. So all of that, again, goes back to being based on the dietary guidelines, which is promoting the same thing. A lot of schools have competitive foods now, which means they're not under the school lunch program, but maybe, your high school cafeteria had a vending machine, or maybe you were in a larger school that maybe had even a McDonald's or a Pizza Hut or something else in the cafeteria. These competitive foods are often high in calories, saturated fat, salt, and sugar, and they're definitely more tempting and they're more appetizing to kids or to teens. So schools are really working hard to reduce or eliminate competitive foods. One, to provide better options, and then two, the school is getting money from these programs as well. So competitive, and that money is going back to making the school better. So competitive foods, that money is basically being outsourced. So supporting these programs is very important. So moving on to more about teenagers. There's a lot going on during the teenage years. And it seems like teenagers, you just eat and eat and eat. Their stomachs are a bottomless pit. There's a growth spurt going on. In girls, the peak is around 12 years, and boys, this peak is around 14. So boys always lag a little bit behind in that growth development through the teen years. Energy needs vary widely during the teenage years. Again, based on growth rate, when is that growth spurt going on? When the growth spurt's happening, needs are increased. Gender affects energy needs, so boys require more energy than girls. There's body composition changes going on. Girls have a higher body fat percentage, and then, of course, physical activity, as we've talked about before. Growth charts are used to monitor gains in height and weight to make sure that children are growing appropriately. So these charts would just help to identify kids that may be at risk for not gaining enough weight, or maybe they're gaining too much weight over the course of their teenage years. Nutrient needs during the teenage years or adolescence are higher than any other time except for pregnancy and lactation. So again, we're concerned about iron. For boys, it's very important for supporting the development of more lean muscle mass, and it's supporting menstruation in girls. Calcium and vitamin D, this is the time for even more rapid bone growth, increasing that bone density, and both sufficient calcium and vitamin D are needed to support that normal growth and density. Again, up until age 25 is when that peak bone mass can be achieved. And then, of course, energy yielding nutrients, so carbohydrates, protein, and fat are very important as well. There are some common concerns in adolescence, and a lot of times these are blamed on different food intake, or they can affect food intake. So menstruation, this is specifically for women. Hormonal changes can affect mood, metabolic rate, glucose tolerance, and food intake, so you may crave more sugary, fatty foods. So it's learning how to deal with those during that time. Acne is not caused by a food or certain foods, and certain foods do not make it worse, or they don't aggravate the acne. Acne is mostly based on heredity, and stress can worsen it. So it's really important, just to try to stay calm, not be stressed out, and that can help to improve acne. Food choices, beliefs, and behaviors in teenagers or in adolescents are influenced by parents, peers, and the media. And I would say peers and the media are the top influencers. During adolescence, food habits are changing, and they're not changing for good. They're changing very poorly, so they're kind of in a negative direction. So during adolescence, again, kids tend to skip breakfast, or they skip other meals. They have low consumption of fruits and vegetables, whole grains. Girls tend to exclude dairy products from their diet completely because they think it's too fattening. So all of this can have some negative health effects. So adults should continue to control the type and availability of food in the teenager's environment, and again, setting good examples themselves and providing teachable moments about why this food might be a good choice, or what could be a better choice, or why this is important. Snacks, again, can play an important role in providing micronutrients or lacking food groups that a child may be missing, but they need to be chosen carefully. There is some new research coming out that, snacking is increasing, and children that snack actually tend to have a lower body weight or a lower risk of becoming overweight than kids that don't snack. But again, this depends on what snacks are being consumed. So if a child is only consuming, chips, snack cakes, other energy-dense snacks, then this is probably going to lead to obesity. So again, using snacks as sort of a teachable moment and meeting those places throughout the day that may be lacking or missing completely.